children, or even you being able to get the gasoline that you need to go back and forth to work, because it's increasing constantly. And all of those things chip away at a mom who is at home trying to put it all together, and then being there for her children. And so the family support staff becomes an anchor in some respects, where they're actually meeting with parents and having parents talk through some of what they're going through, and then coming up with solutions and helping them find some of the things and resources that they need. And I won't go away from this point without recognizing the fact that we are operating many 0 to 3 programs, and we are at a crisis when it comes to formulas for baby. And we know that also is something that is triggering all of these concerns for parents. And again, being able to come to a family support staff to say, I'm in crisis here, that family support staff having some resources at hand to help. And we have some resources we're going to get out to you regarding places to help families find some of that as well. But again, you need resources to be able to do this. I'm going to move over to just the outcomes. You're going to get this deck, but I want you to understand that what we're looking at is all the things that we are needing in order to get to that last long-term goal of children being ready for kindergarten. So some of the outputs, and I'll start there, we needed to have people look at their policies. We had to look at our own as well. But we also needed to figure out, do we have enough credentialed teachers? We know we didn't, and now we've lost some of those. And so what do we need to do to get ourselves back on track for where we were in 2019, for where we see ourselves going by 2024? Looking at family support staff as well. Have we raised salaries? And again, when I talk to you and I work with you and let you look at some of what we have in our data warehouse, what you'll see is we're able to see where some of the salaries are going for some of our staff and where some of that is being tracked. But again, what we wanted to do is make sure that people were thinking about, if you're doing 0 to 3, or maybe doing it all the way to children transitioning from you to kindergarten, is looking at continuity of care and making sure that teachers stay with children. Again, I understand the impact of that when you've got teacher turnover. It impacts everything, and it impacts our continuity of care as well. But we need to be thinking through and talking about some of that, because again, what we're trying to build is the best quality care and system, allowing children, regardless of age, when they come in 6 weeks and moving through our programs, that we're strengthening and working with them across these content areas, raising the gap, lowering the gap in school readiness where children are not showing up ready, raising that percentage where more of our children are showing up ready and able to succeed, and moving forward from kindergarten through 3rd grade and beyond. That's got to be the goal that we all have. That's got to be our North Star that we're looking at, is making sure that our children, when they leave us, if we have touched these babies and they've come through our programs, that when they leave with the skills necessary to thrive on the other side. The CSIDs, and I'll talk to you about that in our next meeting as well. Some of these things are going to take a little bit more time, and there's a lot more that we want to get into. And I'm going to just take some time for the next meeting after the review to dive into another model where not only our data, but the data of the other 5 grantees are going into it, where we will have citywide views and looking at what's going on with children across the board. Same theory, making sure that we are getting resources and doing everything that we can, again, because this is all about children who are showing up ready for kindergarten. And so us doing everything that we can. And so our rationale for all of this is early learning and development, we understand, is relationship-based. Children need to have those caring individuals, trusted individuals in their lives and their programs. Going back to what we know is happening with our teacher and some of our other staff turnover rates that we can see. But we understand that these foster secure attachments, and that then leads towards kindergarten ready. And it starts with our youngest babies when we bring them in, be it center-based or home-based when we're working with our youngest children. But again, what we also know is when we are doing all of this work, we get children who are coming more often. So that attendance, you got to be in the program to get the impact of the program. And so what we would going back to, we're looking back at where we started 2019, and we're going to move forward, making sure that we have strategies, and we're working with you on strategies around ensuring that that long-term goal that we set for ourselves about children being kindergarten ready when they leave us, we're going to come back to each of you and make sure that we are crafting our strategies around making sure that we're able to make the impact that we planned. Again, I know that's a lot. It's a lot on the page. It will be in the deck, and you will get it as a separate document as well, because we are going to look back and we're going to move forward. Moving forward, making sure that we're able to accomplish what it is that we set out to do. And so we've got a lot of work ahead of us. I acknowledge that with all of you. And I know my team who's listening to me are saying, yeah, and with vacancies, yes, we do. But we're going to forge ahead, because again, it's about the children that we serve. This is why we do what we do every day. That's why we come to work. That's why we build these programs. That's why we do all of what we do. It's about the children, and I don't want us to lose sight of that as we move forward. So we're going to come back to this and start our work again that we had to step away from, but we're going to go right back, looking back, and then we're going to move forward. Next slide. So I'm going to go ahead and let some of the other folks come in and do some of their program updates. We do have a presentation that's going to start at 11. We've got someone coming in. So right around 11 o'clock, I'm going to stop wherever we are, let that person get that last word out of their mouth regarding some of the updates. And then we're going to move on and move to our presentation. But right now, I'm going to go ahead and let our program staff begin their updates. Thank you.
Thank you, Sarethel. Good morning, everyone. This is just a reminder for those who have not submitted their community and self-assessments. It's not too late. You can still email the sales-planning@cityofchicago.org. We are receiving them and we are tracking. So my team will reach out to you if we have not received either assessment. Also, for those of you who have missed the first session of self-assessment yesterday, it was a blast. I hate that you missed it. However, next Wednesday, May 25th, we will cover ECE, data, record keeping, and program management, followed by session 3 on June 1st, health, mental health, nutrition, and safety, and June 8th, disabilities, education, and family and community engagement. And of course, you can reach out to anybody from communications and planning team if you have any questions about the community and self-assessment. Thank you.
Good morning, everyone. My name is Dee Nichols. I'll be providing some of the health and safety updates. As Sarethel mentioned earlier, we do have an infant formula shortage, but we have gathered some resources for you to be able to provide to the families. There is a helpline that families can contact. Again, this information is going to come to you so that you can share. This helpline was designated to be able to answer any questions that families may have about which formulas are on the recall. That there is a shortage. We have spoken with our partners at CDPH, WIC clinics, and they have not been receiving many requests, and they said that they are fully stocked. They do receive their products from need. And so, you know, there are certain formulas that are produced by certain companies. So they are fully stocked. They have not received many requests. The other resource to families with this is their pediatrician. So please advise families that they need to contact their pediatricians. And again, you don't have to take this down. We will be sending it to you in writing. We will get that out to you right away. We are also very happy to announce that we do now have our Birth to 3 interagency agreement with the Child and Family Connections Office. This is for our early Head Start program. And so we will be getting that out to you as well very, very soon. And with that, I'm going to turn it over to Gina. She has an update about summer assessment. Gina.
Thank you, Bea. Good morning, everyone. Just some brief disabilities updates from CPS. And first, I would like to say that we are preparing for summer assessment. And as you know, each summer, we plan to evaluate children who have been referred to Chicago Public Schools for evaluation. The cutoff day for summer assessment consideration is May 30th. And so we've been working closely with your disability services coordinators to ensure that all of the children you suspect may have an educational disability are referred to us by May 30th. And so our team has been sending weekly emails to your programs, to your disability services coordinators, just to communicate the children that we are concerned about, the packets we've received, and so forth. And so it doesn't mean that the referrals cannot continue after May 30th. It simply means that May 30th is the cutoff to be considered for summer assessment. So any children's referrals we receive as of June 1st likely won't be evaluated until next school year. So I will tell you that summer assessment this year will begin on July 6th, and it will operate until August 12th. And this is the same amount of time as in previous years. There was conversation about summer assessment potentially being shorter this year. However, it is the same as in the past. And so it's actually going to be 28 days long. The evaluations will be done by appointment only, and so we won't be able to accommodate walk-ins. The evaluations are scheduled in order of receipt, and so these consist of children who are transitioning from early intervention to Chicago Public Schools, who are aging out. These are new referrals from your programs for children you suspect may have an educational disability. We're going to have 3 locations this year for summer assessment. The first one being our city center, which is Garfield Park Assessment Center, and that's located at 2651 West Washington Boulevard. And so many of you are familiar with that location. We are also going to be offering a Shoup Academy, which is at 1140 South Bishop, which is actually 111th Street South and just off the Dan Ryan Expressway. And so that's very convenient for our South Side families. And then this year we're adding a 3rd location, which is called Westinghouse. And that is very close to Garfield Park as well. I can actually give you the address if you would like that. Westinghouse is located at 3223 West Franklin. And it's actually George Westinghouse College Prep. So it's one of our high schools, and it's, again, very close to Garfield Park, but just building capacity. The reason we want to have a 3rd location this year is that our goal is for 100% of CPS staff to return in person for the evaluations. So as you know, since the pandemic began, we switched to a remote or a virtual option for our families. And we moved then into a hybrid model. And now the goal for Chicago Public Schools is 100% in person. So we will be inviting our staff 100% in person this summer. However, families still have the option, if they feel more comfortable bringing their young child who is not age eligible for vaccination as of yet, they are welcome to join us virtually via Google Meet, and they can participate in the evaluation in that manner. I do last want to share that we do have some upcoming virtual PD trainings for your staff, and you will want to register for these on COPA. Tomorrow is our next training, and that one is from 12:30 to 2:30, entitled Federal Laws, Inclusion of Children with Disabilities. And so if you're interested, or your staff are interested in learning about all of the important federal legislation governing including our children with disabilities in our programs, we invite you to join us 12:30 to 2:30. It will be via Zoom. And again, registration is available on COPA. So we're looking forward to that. And then next week on May 25th, we have the ASQ3. That's the Ages and Stages Questionnaires 3rd edition. That is for our Birth to 3 programs. And so it's open to site directors, open to education coordinators, disabilities coordinators, teachers, anyone who needs to learn or wants to learn more about the ASQ3 tool. And then next we have our CPS referral process training. And this is important for anyone who wants to know all of the procedures, timelines, forms that are required to refer a child to Chicago Public Schools for evaluation. And that is coming up. Let me check my date. I believe that will be on June 3rd. Let me just verify that. And again, the trainings are 12:30 to 2:30. The reason being, we want to invite teachers, and we know this is a beneficial time during nap time. I need to check the date on the referral process before I leave you. And we also have the ASQSE2. That's the Ages and Stages Social Emotional Questionnaire, 2nd edition. This is for all of our birth to 5 programs. And so if you have staff who need that training, that will be happening as well. Let me double check that date, and I apologize. Yes, so just to confirm, June 3rd will be the referral process training, CPS referral process from 12:30 to 2:30. And I will double check that ASQSE2 date. I do want to make one mention before I leave you that this year, children aging out of early intervention whose birthdays happen to fall between May 1st and August, I believe 31st is the cutoff, they will qualify for extended early intervention services. But the caveat is they must be found eligible for continued services by Chicago Public Schools. And so if you have questions about whether your EI transition children are eligible for extended EI services throughout the summer, please reach out to your Erickson team or to me. I can help assist as well. And I think that is all. Do we have any questions?
Yeah, can you just repeat the name of the training and then where specifically in COPA it is?
Gina, we're going
Yes.
to, Gina,
Yes,
we're going to send this out to everyone.
Okay,
Okay.
cool. That's
We
fine
have the
then.
names and the names of the training.
great. Thank you, B.
Thank you, Gina. So next, Martins.
I believe this is Nicole Roberts.
Hi, good morning, everyone. I'll go over the expenditure rate information and then our fiscal updates. So as of now, through April, we are currently expended at 21% for our Head Start grant, 13% for Early Head Start, 16% for CCP, and 15% for expansion. Next slide is our state funded grants. Our early childhood block grant is 49%, and we have 2 months left of that grant ending June 30th. And then for childcare, 42% with 2 months remaining in that grant period as well.
I'm sorry, Nicole, I added this in the middle of your report, and I'm sorry because I wanted to make a point about the funding, and then I'm going to turn it right back to you.
All right, thank you.
So again, I'm on my soapbox, and you just saw where we are with our expenditures. We are basically a little over 30 days left in our ECBG grant, and as you just saw, we're only 49% expended. I had talked to you before, and what we turned back last year was about $12 million. We're on track to turn back about 25 million. I just want you to hold on to that for a moment. I need everybody to understand that we can't have that kind of money be turned back. We do have a deadline date of June 1st that we have to let CPS know what will go underspent for PI, because those dollars will go back to CPS and they will take those dollars, and they have the ability to take those and then use them within their PFA program. If we're not using them, they can take those dollars back. And so we only have until June 1st to come up with that amount that we will be saying back to CPS around the dollars in the PI grant that's going to go back. This is a huge issue, and I need everybody to understand. We are in discussions right now, every Friday with the mayor's office, with CPS, and with Bloomberg and Associates, who's been brought in to help understand and how to help us with this underspend issue. This is big, it's a crisis, and it's critical that we begin to address this. I know one of the things that we've consistently said is that we needed all of you to consistently voucher, meaning monthly, By not doing so, it's very, very difficult for the team here to do everything that they need. So we're going to have to make some judgment calls because we don't have anything else that we can do, looking at where you are, what you've expended, what your monthly expenditure looks like, and then calculating and making some determinants about what will be left that you will be able to be authorized to use. But we're going to begin the process of using and doing some things with those dollars. I'm going to do everything I can not to turn back that mass amount of money back to CPS. And that's some of the conversation that we're having every Friday. And so we are looking at a couple of things that we will be doing. I will be having an emergency meeting with those of you that are funded by ECBG, where I'll go into more detail around some of that. But right now, I just want to say crises, crises, crises. I know many of you did a budget revision saying what you would be able to use. I know some of you were unable to use all of your slots. I know all of the reasons behind some of this, but at the end of the day, the large amount that could be left on the table is just not something that we can do. And one of the things we cannot do is have this be what we do every year. And so just know that there's a lot of discussions around the ECBG program, and some decisions will be made about how dollars are being used. So we have some work to do, and we're working here. And we're working again with the mayor's office. We're working with CPS and with the contracted agencies that's been brought in to look at some of this. And so understand that there will be an emergency meeting that I will be scheduling with you to talk a little bit more about this. But again, if you have vouchers that are out there, you got to get them in. If you're waiting on a budget revision to be approved, then let us know that. Send me an email. It helps me understand exactly what's going on with yours. And I know my team here in CSD has been reaching out to the agencies and asking about your underspend and about your vouchers and about your getting things in. And so we're working on our end, and I need you to work on yours, but we also need to come together in this meeting and really discuss what we will be doing with the funding for the remainder of this year and some of the projections on things that may be happening next year as well. That's the early childhood block grant, but we're also not on task and on target for our HHS, Office of Head Start funding either. And we're in our monthly meeting, Office of Head Start is raising this as an issue as well. I know some of you at different times, and a couple of people have actually sent me some requests needing some supplemental things done. It's really hard to project what dollars I have available in either one of these funds to give you any additional assistance when the dollars aren't being used on a consistent basis, so that what we might be able to project we can do to assist. I can't just take that and move those dollars. I need to know that we have some dollars that are not going to be spent. And so what I know is not going to be spent on ECBG, we're reprogramming it. For HHS and Office of Head Start, if you're asking for supplementals, understand you have to be on task and on target, utilizing your current dollars before I can actually approve a supplemental request for any of those, because the first thing is to use all of the dollars in your current contract. A reminder, we have required, and I'm saying it again, we need people to voucher monthly. It helps us project and predict what dollars are going to be out the door so that we can do some reprogramming on our side versus giving it back to CPS for them to reprogram. It should be us reprogramming these dollars. It should be us having the ability to do these things that would benefit your programs. And so again, this is teamwork. It's got to be a teamwork effort. Again, I'll be planning an emergency meeting, and I will talk more, especially about what's going on with ECBG with those of you. And so when you get the notification, I do ask that you be there. And if you have a fiscal staff that needs to be a part of that meeting, we'll be asking you to bring them to that meeting as well. Nicole, I'm going to turn it back over to you.
Thank you, Sarita. All right, so for our FY22 grants, as Sarita mentioned, it is very important to get your invoices in on a monthly basis. We need to show our funders that we're consistently spending. And in addition to that, if you end up receiving any deletion memos, rejections, we want to ensure that we are addressing those as soon as possible to avoid any issues at closer to closeout. All invoices should be submitted through April 30th at this time, and continue to review your actual expenditures to your budgeted amounts to make sure that you're submitting a budget revision when needed. COLA, as Sarito mentioned, the applications were due yesterday. The team is currently reaching out for any that are missing. Please be sure to get those in as soon as possible today. We're on a very tight time frame. For our pandemic funding, the award notifications are pending. Further information is to come in regards to that. Next slide, please. For childcare, again, make sure that you're getting your vouchers in. They should be submitted through April 30th at this time. For the Block Grant PIPFA, same thing. All invoices should be submitted through April 30th. The budget revision cutoff was May 13th. If you were unable to make that date, you see you're experiencing any delays, please be sure to reach out to your accountant, Monica Almanza, as soon as possible to see how we can assist you. And just keep in mind that the invoice deadline for FY22 PIPFA is July 22nd. And we need to do our best to ensure that we stick to that deadline. So if you have any deletions that are still sitting out there that have not been addressed or any invoicing issues, please be sure to contact us so that we can assist you with any issues that you're experiencing. And again, on this slide, I'm referencing the iSupplier training materials. There's also updates on there for future training dates. We were told by OBM that should be updated very soon. There's very good material there, so please check that often and get familiar with it. If there's any questions at all, you can always reach out to us. And then we have your finance contacts listed here for each grant. Thank you.
Good morning, Nicole. This is Juana.
Hi, Juana.
Good morning, everybody. You mentioned a percentage of expenditures for expansion, but I didn't get the number. What was that?
Can we go back to that slide, please?
Thank you.
Sure. 15%.
Hello, everyone. So I'm going to go through these slides. I do want to ask a question. Martise, do we know if our presenter is on?
They have not logged in yet.
Okay, just want to make sure. Thank you.
Okay, you're welcome.
So I want to just give you a couple of updates regarding what's happening with our working on our new data system on top of getting ready for federal review and everything else that we're managing. We're still moving forward with developing this new database system. And so there is and have been admin trainings, and they will continue through Friday the 20th. There's going to be a break, but they will start again on Tuesday the 31st, and they will go again through June 10th. And so, and just what we need is for you to make sure that your system admins are registering for the training. And here's the address on here. We do know that there's been some issues. I want to say that right now I'm receiving emails. I know my staff, Stacy Lynn and others, are working with the vendors where we're finding that there are issues and people have registered and still not able to access or did not receive the information allowing them to get into the training. And so we're still working on some of those glitches, but I thank those of you and your staff who have participated and know that this is admin training, helping them understand how to access these systems. And so far, you see the numbers in front of you where we have had people actually join. And so people have confirmed there were new admins, and then there was 27 that actually attended. And so again, as we continue to do this, we just need to make sure that your staff are registering. And if there's any glitches, we're sending information out to staff on who they need to reach out so that they can get into these trainings, because we want everybody to be able to get through the admin training. I know there's been some conversation around who we consider admin and who you are considering admin. And I know I looked at a list, and many of you have registered many people, and you are considering your teachers in classrooms as admin, because from what I'm looking at is that they are actually putting attendance into your system. They're doing your daily attendance from their classrooms. We're going to be trying to verify some of that to make sure that the right people get trained and that we don't lose sight of what it is that we need to do in order to make sure everybody gets access to this training. So we're still working on our side. We're working with you, and I know our vendor is actually conducting these trainings. But again, they are going to continue through Friday the 20th. We will take a break. They will come back on Tuesday the 31st, and they will go forward through June 10th. Next slide. And so driving awareness, what we've asked you to do is we've sent and we'll send and continue to send out emails to you with supporting resources, different things that you can present to yourself, so that you can read up on it, but also that you can use for your staff. And we're developing a video for end users to learn about the project as well, because we want to touch and we recognize that in order to ensure that everybody is able to get what they need, we want to use as many mediums as we can. So videos, documentation, going into the digital hub and getting information. All of those things are access points for information, and we'll continue to use all of those as we continue to build this new system. But we want you to continue to pass information and things that you've learned about this project, put it into the digital hub, make sure that your staff are accessing the digital hub, make sure that you're looking at the changes and are aware of what's going on. I'm just asking you to keep up with what's going on as we move through this process. We are now in May, and our goal is to have this system stood up by August. So, there's a lot that's going to be being done over the next few months, and we just need you to continue to stay the course with us and continue to walk through it as we're trying to stand up this new data system. Next slide. And so we've got some good momentum going. People are using the digital hub. So yay, thank you. Thanks to all of you who are going in. If you've had the opportunity to access it, please let us know, give us your feedback, let us know if this is even a value add to you, because what we want to know is whether or not this is something that is going to bring more information and accessible information to you. We can't just let it be the EDPD. We know it can't just be CSD update. We wanted to give you a place that you can actively go in and get information. And so here we can see that 52 downloads for the FAQs, or the frequently asked questions. There were 37 messaging regarding agencies. And so I know that people are going in there. 19 people went in and looked at the leadership guide. So we're getting data from the system. The system lets us know every time people are going in. We can see who's going in and what they're actually tapping into. This is helpful for us to see whether or not this is actually beneficial to you, because it was never the goal to present something that you wouldn't find useful. And so we'll continue to do this. And as we add other tools, we will be putting them in a digital hub again, because we want you to be able to access it from your house, from your program, for your staff, again, as we're continuing to go through. So I want to thank you for those of you who've gone in, those of you who have not. We'll make sure that the login for the digital hub gets back out there. Thank you. I see that. Gwendolyn, we'll make sure that we get the login so that everybody else, if you have not gone in, that you have access and can get in. So I see that, others are asking for it. We'll make sure that we put the login in on there. We'll send that out as we're sending this. If we are not able to get it into the chat before we leave, we will definitely make sure that you get it. I see people saying you don't have access to Salesforce. Well, we're not done yet. What we're just doing is starting to train system admins. And so if people are not trained yet, the information for registering for training was put into the chat. So you can click on that and actually get your system admin staff register for training. It's in the chat. That was done. I do see a hand up from Meg, so I want to stop for a second and see what questions you have. Go ahead, Meg. You can unmute.
There, yeah, I had a quick question. There was some talk a while ago that for participants in CSIDs, there might be an opportunity to reduce the dual data entry and to have information flow directly from there to Salesforce. Has there been any progress on that?
No, Megan, let me explain some of the why not yet. Some of the dual entry that agencies are doing are those that are funded for Head Start, Early Head Start on another contract, but they have PFA, PI from us. As everyone knows, PFAPI, that ISBE report, what it takes for us to get that from us directly to CPS is a huge lift. My staff are constantly going back and ensuring that everybody is putting every element that is required in that ISBE report in COPA so that we can pull the report and get it over to CPS. And so until we're able to get into Salesforce, until we're able to see that we're able to process that report out of Salesforce, we are not going to go directly to a direct feed. Is it something that we have been lifted? It's something that's been lifted. And yes, I have talked with the individuals that are managing the CSID system. They've lifted that as a request, and I've talked it through with them. But what I have to say to everybody here, as you know, when we're getting ready to do our report to CPS, it's both the classroom data and the staff data. What's going into CSIDs right now is information on children. And so in order for us to have a classroom count in the ISBE report, we need that qualified teaching staff information. We need their IEIN number. That has to attach to that classroom, that has to attach to the children that are enrolled, and then their reports and their files are accepted by ISBE. So this is a massive piece of work that's being done by DFSS in order to affect this. We're working with Salesforce. They understand some of what I'm talking to you about, Meg. But right now, that's not going to be one of the first iterations in Salesforce that we're building, is to do a direct feeds into CSIDs. And it's for all of the reasons that I've just mentioned.
Thank you. That's helpful to know. And yeah, I appreciate it.
You're welcome. And Megan, I see your hand up as well.
The question is along the same lines. What about COPA? When you guys first started talking about the system, it sounded like a lot of information would be transferred from COPA over, but in the training, they make it sound like we're going to have to do all that work on our own. So can you just clarify?
What do you mean work on your own?
Inputting teachers again, classrooms again, all of that information.
Well, what we're going to be doing, there will be data dumps that will go directly into Salesforce to eliminate some of that. But again, we're just at the first phases of this, but it is our plan. And I know my team here, the IT team at DFSS, will be working with COPA to do downloads, and then they are working with Salesforce to do uploads. And so there will be some iterations of that that will allow for less of that that you just described about going back in and having to do that data entry all over. We're trying to do everything we can to not have you do that.
And then what about the children? Should we only be having newly enrolling children doing this, or will we have to input all children ourselves?
We're going to be going back over all of that with you. And once I know that I have a clean feed, I want to make sure that what's going to come from our current system, the current children that are in there, if you're currently serving them, that's sitting in COPA data, and getting all of that data into a system that can then feed into this new system. And we're having to use, and I'm not the techie person, but we're having to use some other software iterations to allow for some of that transfer of data. And so we're working through that right now. But what we're trying to do is make sure that as your new children are coming in, that you have a system by which you can enroll new children. But what we know is that we need to have for Office of Head Start, if not for nothing else, we have to have historical data. So we're working on making sure that that historical data is there for you.
I have a question.
Okay.
So I attended the training, and basically they told us that it would be a waste of time if we didn't have our login to Salesforce. So even though we're getting the link to register, we still need a login in order to get into Salesforce in order to walk through it. So basically they were telling us if we don't have a login, just come off of the meeting and don't stay, because it'll be a waste of time.
Okay. Well, thanks for letting us know that. I've got staff one that's hearing you right now. I know that has been one, and that's why I mentioned it. I know some people had issues getting in, and we're trying to make sure that we are working with them on that. I see that I have something from Linda saying the same thing that happened for them over there. And so what we have to do is, and I see Anita, you're saying the same thing. So we're trying to make sure that whatever these glitches are, that we're working through them. And so we have more, and we're getting information from you right now, and we're going to be taking this back to the vendor again. Because the goal is for you not to just get in, register, but for you to have that link be sent to you so that you can access the training. That was the goal.
If I was just to ask right there, because I met with Salesforce last night, we will be reaching out and people will have logins. We put a system in place. We heard emails.
Thanks to Melanie.
So yeah, me and Peggy are on it. So everybody, as long as you register, we'll make sure you get that Salesforce login.
Thank you. And again, the link for the training is on the in the chat box for everyone. So, you know, you can copy and paste that so that you have it, so that you can use it and others can as well, so that you can get into it. Thanks again. I know my staff and others are working to make sure that we are not complicating your life on the other side of this. I will say that when you're working with something as massive as what we're doing right now, and this is a huge undertaking, that there will be glitches. And I want to apologize on behalf of DFSS and everyone, and to you, that this was never intended. And so I apologize, and I'm hoping that with everything that they're doing right now to work through this, that we'll get you in, and we'll see fewer issues happening on the other side of this. I was looking at chats to see if I'm missing anything. Again, one of the things I just want to say, the goal is for us to ensure that we do everything we can to upload information from our COPA system into our Salesforce system, so it's not starting from scratch. We're using a lot of the fields, but what we're also putting into the new system are stop measures. In other words, to stop people from moving forward, if you're not giving the required information, you can't complete an enrollment, or you shouldn't be completing an enrollment if you haven't put everything that's required in the system. So what we're working is to make sure that people have to stop and include what's required. That's going to help us get to the point where we might be able to get a clean ISBE report, and then we can talk again about what some of the possibilities are for some of that. But right now, we're not there. It is something that we're working towards. So I'm going to ask one more time. Martise has our presenter signed on. It is 11.
Yes, Terry is here.
Great, great. So what I'm going to do is I'm going to stop. I will keep watching the chat to see what else comes up as I'm doing this. But I do want to thank you, Terry, for coming and being with us. I'm going to, without everything in front of me, and I apologize because I'm working on 3 different things at the same time, but I'm going to let you introduce yourself and talk more about your project. And so we're turning this over to you, and then I'll come back once you're done. So thank you, Terry.
Thank you so much. And thank you so much for inviting me today and giving me a little time to chat with the group. I'm Terry Sable, and I am a professor at Northwestern University in the School of Education and Social Policy. I am also a former Chicago public school teacher. I taught 1st grade. And I am collaborating on a study to examine the rollout of the universal preschool program that's happening in Chicago. This is joint with the Office of the Mayor, with DFSS, and Chicago Public Schools. And so what I was hoping to do today is to describe a little bit about the study. I shouldn't take up too much time. And the key goal is to see if we can, if anyone on the call or the Zoom would be interested in participating in a study in which we interview you to understand your experiences with the rollout of universal preschool. Just a little bit of background on the Universal Preschool Program, if you're not aware, but I'm guessing you are. So this was an initiative from the Office of the Mayor to provide free full-day preschool for all 4-year-old children in Chicago, irrespective of their income. And the rollout began in 2019, and they took a community-based approach where they rolled out to 22 neighborhoods in 2019, with the goal of basically rolling out to all neighborhoods. It's been a little delayed with COVID, but by around 2024, I believe. The universal coverage includes both school-based pre-K programs that are in Chicago Public Schools, which meant that they had to create a lot of new slots within those school programs, but also attempted to leverage the existing community-based organizations that already existed that were providing free full-day preschool, with the goal that it would sort of collectively provide universal coverage across both school-based preschool as well as CBOs. And so about a year ago, the city approached us to say that they really wanted to understand the experiences and the impact of this rollout. It's a significant investment, a significant change in the Chicago preschool landscape. And they really wanted to be out in front in understanding the impacts, both in terms of the access, in terms of whether they're actually increasing access for 4-year-old programs, but also the impact on community-based organizations. And so we developed these questions with the Office of the Mayor, the Chicago Public Schools, as well as DFSS. The team is led by myself, as well as Diane Schanzenbach, who runs the Institute for Policy Research at Northwestern. And our key goal is to really understand what happened as this program has been rolled out, particularly during the COVID-19 pandemic, and how has it affected, how kids find school, how many schools are open, what kind of experiences kids are having on the day-to-day, as well as the impact on their school readiness. To do so, we're relying on a bunch of data that already exists that you all are probably already filling out. So nothing, you don't need to do anything on that end to understand, for the example, like we'll look in kindergarten to see like what happened in kindergarten on kids' test scores. But another key point is just really understanding the lived experiences of what's happening, and particularly your vantage point as part of providers and as the leadership of early childhood providers to understand what it's been like and what the challenges and opportunities are. And my guess is it's going to be a mixed bag of what this has meant for your particular childcare center or preschool. So that's where you all come in. So what we're really interested in is understanding from your perspective, what are the challenges and opportunities that this rollout has meant for you all in the midst of the COVID-19 pandemic. We're trying to recruit probably between 10 to 20 center directors and as well as 10 to 20 Head Start center directors to really understand your experiences. And then we're also going to interview principals or directors from Chicago Public Schools. And collectively, we would put this all together to try to understand if there's some themes or commonalities in the experiences, and there might not be, but that's also interesting too. But this would definitely feed directly back to Chicago Public Schools, to leaders at DFSS, as well as to the mayor's office. So it's a chance for you to kind of, explain your experiences for better or for worse. So what we would ask from you if you are interested is we would basically, one of our trained researchers, including myself, would conduct an interview with you on Zoom. So the lift should be pretty light. You don't have to come find us. We'll try to schedule it with whatever kind of works for your schedule. We can pay you for your time with a $50 gift card. And the broad questions that we're really interested in are things like what is working and not working for you, both during COVID, but also during the universal preschool rollout, especially about how it's affected what you're offering, teacher retention, administrative burden, whatever it may be. We would basically then take your interviews, we would record them, take them, and wipe out anything that identifies you, like the name of your preschool, et cetera. And then basically try to collectively see if we can find some themes across all of the interviews. So I basically, that's the big overview. I have a really lovely team. Hope Salvador, unfortunately, is kind of leading the qual stuff. She couldn't be here today because she's graduating, but she'll be kind of the point of contact. So I will put her email address in the chat. And if not, it's basically just a flag that if you hear from us, this is the project, and I can kind of open it up for questions that people may have.
I did see one person, I haven't been able to get back to chat, that did say that they were interested. And so this is being recorded. What we will do is go through, and anyone who has lifted, the staff will go in and we'll make sure that you get the names of those organizations.
Awesome. Yeah, that's probably the easiest if you want to direct message me or put it in the chat, and then we can reach out to you to find a time that would work for you.
Anyone have any questions while we have Terry here about the project or any of that? And you can unmute and ask your question, raise your hand, and I'll acknowledge. All right, Terry, so I see nothing in the chat with questions.
Actually, there's a really good question that absolutely you will receive the results from the study. I will share it with DFSS, and I also can come back if that's okay, not to invite myself, but I can come back and present the results from the study and have a more kind of open conversation.
Good, thank you. All right, so seeing no other hands, no other questions in the chat box. Scrolling through to see if there's anything that we've missed. We're getting the contact information for who you need to reach out to after registering for training if you don't get your link. So we're going to make sure you have that. But you can also contact Tamela White if you're having some issues. Tamela, please put your email address in the chat box so people have that. But as we move forward, and again, it's a lot going on and we understand that. There's a question here, how do we get access to applications from GoCPS? We are working right now to make sure that you have that access information so that you can pull your applications down. As soon as we have all of that, then we will be sending that back out, making sure that everybody has access. That information, the applications aren't going to port directly over to COPA. But you will have access into the SchoolMint location so that you can go in and pull your applications down. You're also going to have access to the system so that you can work with parents to make sure that they're able to get their applications into the system. We know some parents come directly into your organizations and will need to do an application. And so you'll have that as well. I see Marcia saying it was a great training, even though she didn't have login, she stayed on and she felt that she still got something out of the trainings. Thanks for saying that, Marcia. I'm just going through the chat box before I end and leave you. Want to make sure that we've covered everything. How does the new system filter where a child is accepted? Right now, what's going to happen is the acceptance letter will go to the parent's first choice, be it CPS school or one of your organizations. So you will, that offer letter will go to the parent saying that this was the request of the parent for their child for the next program year. Remember, this is for program year 2022-23. And so once that acceptance letter goes out to that parent, or the offer letter, let me say this, offer letter, because you have to go through the process of accepting parents into your program and making sure that they have a seat, and we recognize that. But parents will be getting offer letters that will be coming out. And so once the offer letters come out, they will be able to, and they'll start contacting all of you. So offer letters are going to start coming out starting the 24th. And what we're working to make sure that you're able to access systems so that you can get in and have the information that you need. So we're feverishly working on both the Salesforce side of this, but also the application side of that. So I'm scrolling one more time to see if we've missed anything. All right, so I'm not seeing any new questions, but just know that we're here. Remember, this is a recording, so you will all get the recording, and then the recording will be, and you'll have the deck, so you'll have the information that you'll need. Again, if you're having issues regarding the training, please reach out to Tamela White. We will make sure that you have the access or the information you need for the name of the person at the vendor site. So if you're having some issues getting your link, that you'll be able to do that. I know that you are overwhelmed on your side. I know we're piling more on you with all of this training, but I thank you for taking the time, both for being here today and also for committing the time to go in and do the training on the other side so that your admin staff and you're able to actually get in and use all of this. I do see one other question. What happens if the parent receives an offer and the slot and the seat is not available? The agency has already filled that slot based on their internal waiting list. Then again, what we're going to be working with, the parent then will be able to work with the Illinois Action for Children hotline because they are putting 5, again, they're coming up with 5 choices. So if they can't get the seat at your site, they will know that they have an option for going to a number 2, a number 3, a 4, or a 5. And so they have gone into the system, and most of them, when we were looking, were actually coming up with multiple options, knowing that they may not get their first choice. And so they will be able to go back in and they will be able to seek the seat and the second or third choice that they've chosen. And so we're going to continue to work through this process because the goal is to get children and families enrolled and children in seats. And so we're going to continue to work through this process. Both our staff, Illinois Action for Children, manages the hotline where parents are giving the number. They'll call in and say, I didn't get that seat. They'll work with them to make sure that they're able to understand how to then use their second, third, or fourth choice. Seeing no other questions come up. It is 11:13 and I don't want to hold you here because I know every one of you have a lot of work on your hands and that you're very, very busy. Just know that we're here. You have my email. I'm going to put it in the chat one more time. And so if somebody has a question for me, I just say, go ahead, reach out to me. And I do everything that I can to get back to you. I will tell you that I am down managers here, as many of you know. And so if I don't get back to you right away, know that it is my intent to respond to you. Even if I don't have an answer for you at that moment, I will respond to you, letting you know where I am in the process, and I will work with you to make sure that you get your needs met. It is our job to make sure that we're here for you, just as you're there for all those families out in communities. And so as always, I thank you for everything that you do every day for every one of the children and families that you serve and everything that you do in the communities. You are the hubs and you are the place that people go to every day to get their needs met. So I thank you for being there, especially through the crises and everything that we've been through over the last years. And so thanks for staying the power. Thanks for keeping yourself safe. And that's what I ask of every one of you. As I say to you every time, I need you where you are. So I need you to do everything that you can to take care of yourself, take care of your staff, parents, and children. But again, if we're not taking care of ourselves, and all of my staff be quiet because they are all on me about me taking care of myself right now. But if you're not taking care of yourself, you can't take care of others. And so with that said, everybody, please take care of yourselves, and we'll talk to you very soon. And you will, those of you who have ECBG will be getting notification of an emergency meeting regarding that grant fund. So everyone, please take care, and we'll talk soon.